Namaste and welcome to the next lecture of Clinical Ayurved by Dr. Mayuresh Agte. We were discussing Anna Sudas Vyadhi and we have started discussion with Amla Pitta. I am repeating what I said in last lecture. When a patient comes to you with the word acidity as a diagnosis in his mind, please don't get biased and ask him actual what symptoms he has, because patient has a very misconceptions about the word acidity, and they may sometimes may have Agnimandya, Adman, Rullas, whatever the symptoms are. Hence, they name it as acidity, but you have to go in deep and just know what exact symptoms he is suffering from. First thing, I have put you a question that in the text you will find two sets of hetus as far as Amlapitta chapter is concerned. One is Guru, Snigdha, Abhishandi, Ishtame Padartha, Gorasa, Ikshuvika. Other is Tikshna, Ushna, Vidahi. Now, these two sets are exactly opposite in nature. What will be the actual samprati will be happening? Because in the text they have mentioned there is by hetu it is Agnimandya, Amapati, and then Vidadata, and patient gets Amlapitta. But the hetu which are Tishna, Ushna, Vidahi in nature, they will increase Agni in spite of creating Agnimandya because they are of Agni Saman Gun. So let us this topic today. First, keep aside the Tishna Ushna Hetu. First, we will discuss Guru, Snigdha, Ikshuvikar, etc., which are of Guru, Snigdha, Drava Gunatmak Hetu. What will happen if these Hetu are consumed by the patient? Now, when a patient is consuming this Dravya, they are Agni Viruddha, so they are automatically Agnimandya is going to happen when they are consuming this hetu for a longer time. And Agnimandya Amapatti is a natural state happening in the body. Now, if you go through these hetu, you will find they are more closer to the kapha dosh or ama itself, because nature of ama is very similar to these hetus. Hence, my observation in my practice is when such patients, such hetu are seen in the patient, these patients are more prone for amajirna, and symptoms of amajirna are mostly seen. They are very similar to the symptoms of Amlapitta, Amlodgar, Avipak, Klama, Utklesha, etc. So you have to differentiate between these two as a diagnosis, whether it is Amajirna or it is a real Amlapitta Vyadhi, and how you will differentiate this thing. For this, you have to go to the duration of the symptoms. Amlapitta is a Chirakari Vyadhi. So, when a patient says, I have such symptoms and the duration is for few days, I have gone to some lunch or some function, I have eaten, and there is a continuous more eating of food, and the symptoms are occurred, you should think of Amajirna first. And when a patient says that I am having this problem for a longer time, first thing. Second thing, he will say that before the problem started few months back, when I used to eat some heavy food, then I used to get this problem of ajirana. But now, even if I eat a lighter food, a home food, that too in a small quantity, still it is not getting digested properly, and I am getting Amlodgar, Guruta, Klama, Utklesha, etc. Then you can you should have in your mind that now these symptoms are so much chirakaritva has been seen now, and then you can nominate that stage as amlapitta. So Amajirna, the hetu will be same in the both cases, but Amajirna will be have a very short history as far as Kala is concerned, and when a patient is really having Amlapitta because of these hetus, then you will find that constant consumption of this Guru etc. Ahar has damaged Agni in a so much extent that now a Lahu Ahar or normal ahar which is made in home, which is not spicy with dhi etc., is also the agni is not in a state to digest that one. So always remember, when you stamp the patient as amlapitta, as amlapitta is a chirakari vyadhi, the history of the symptoms should be of a large period, and when the history is short, you can go for a amajirna. Why I am telling you these things? Patients comes to you with the word acidity, but you have to differentiate these two things because much more symptoms are same. And why you should diagnose it in that way? Because there is Ama Nirmiti, so you are going to do Am Pachan as routine treatment. So does treatment differs much more? I think not. I will discuss it in next lecture. But you have to diagnose it or stamp it as a Amajirna or Amlapitta, because you have to convince the patient that if it is Amajirna, the shorter period treatment will be enough, and it is, if it has been now converted into amlapitta, you have to convince the patient that he has to follow the pathya for a longer period, and you have to convince that the treatment period will be also longer, and up to that period he has to follow every instructions unless and until the agni is again in its prakruta avastha. This amlapitta which is expected in the grantha, see in ajirna also there is agrimandya, amapatti and symptoms of ajirna. In amlapitta they have also mentioned the same pattern, but what they have mentioned that this process in amlapitta is going for much more time, and hence it takes much more time to recover also. So if you have to cure the patient as a amlapitta, then convince the patient that it will take time, because the samprati has happened since many days or actually months. So this discussion is about the set of hetu, which is first set of hetu of Guru, Snigdha, etc. What happens when a patient comes with the hetu of Tikshna, Ushna, Ruksha? They are Agni Saman, so in my opinion they should not create Agnimandya or Amotpatti. On the contrary, they should increase the Agni and patient should eat more. There is no chances of Amotpatti because of Agni Saman Guna. What actually happens in patients with such hetus will be discussed in the next lecture. Thank you very much.